really wanted to focus on was we know that the UK and the NHS in particular has kind of a big reliance on internationally recruited nurses. But there's not as much focus on the kind of nurses that maybe we're losing. And really this piece of analysis wanted to look at registered nurses, nurses that are registered to the UK Nursing and Midwifery Council and whether they have intentions to leave. So in much of the same theme of migration, on our runway today is to contextualize why this is an area of interest, what essentially our research question was, the level of the data that we had access to and how we tried to take it apart, what we ended up finding, how these fit into what we can understand from the global picture in terms of nurse migration, and ultimately what implications this has for policy. So why is this an area of interest? Well, we obviously know that nurses are hugely invaluable to the health and care system. They are one of the largest single staffing groups within the NHS workforce, but also it means that they account for a huge number of vacancies, so over a third of all vacancies in NHS England. So this is why it prompted us to look into this as an area of research. Amidst this, we know that there's huge levels of demand, that we have an aging population, and we are still reeling from the COVID-19 pandemic to meet this level of demand. So given all of these situational issues, it really helps to have a fully funded national workforce policy and understanding what is the state of mind of staffing groups that really serve the NHS invaluably. Ultimately, we know, however, that even if there are workforce crises, it takes time to grow nurses and doctors and other healthcare professionals, but also it costs a lot of money. And so to really come out of this with a good solution, we're going to have to use a mix of short-term and long-term policy approaches. The short-term policy approaches has often been increased international recruitment, so really going abroad and looking for nurses that are trained in different countries to supplement some of the workforce issues that we have within the UK. But this is not without issues around sustainability, but also the ethics of this practice. I'm sure you'll know from the COVID-19 pandemic, the WHO published a red list of countries to recruit from, where recruiting from these countries actually destabilizes the health and care systems within these countries. So over the longer term, we're going to have to settle some of those long-standing disputes around pay, staffing issues and workload, and ultimately do better to retain our really talented workforce. We know that the long-term workforce plan was published last year and ultimately brings about a big idea of how we can reduce reliance on international recruitment as we approach the end of the time period set out within the long-term workforce plan. But what do we know about the type of nurses that we've already got recruited? We know that at least 1 in 5 of the nurses and health visitors employed by the HCHS, which is the Hospital Care and Healthcare System, reported a non-British nationality. And we look at the NMC registration data, and even though not all of these registrants might be employed by the NHS, because you only have to register once every 3 years, almost half of those who joined the register in 22-23 were trained outside of the UK. So you can really see a scale of how dependent we are on internationally trained nurses to supplement our workforce. The NMC also conducts its own survey about people who leave the register. And a lot of the reasons are some that you can expect. People citing burnout, thinking that they left a lot earlier than they planned to, having a lack of support and high workload. But it also differs based on which country you trained in. So nurses who are trained in the UK wanted to leave because they wanted to retire. But those who are trained outside of the UK, so both either in the European Union or outside of the European Union, just wanted to leave the UK. We know that, again, there's been a big inflow on the number of nurses that come in, but this is probably the first piece of analysis that looks at whether nurses are looking to leave. And ultimately, this analysis is on potential nurse outflow from the UK between the period that we have data available for. So what kind of data do we have available? We're using certificates of current practicing certificate status, known as a CCPS, and this is also known as kind of like a letter of verification. It basically confirms that you're registered with the NMC, you have your professional qualifications have been verified, maybe it will tell you when you studied, how long you studied for, and whether you have any black marks on your status. And this is the basis of our analysis. Really, we can understand how many applications were made across the period of time. But we're also able to look at where nurses studied. The NMC divides this into 3 different categories: those within the UK, those within the European Union or Economic Area, and those classed as overseas. We can look at this in combination with where they're looking to apply to. So which countries are these nurses looking to go to? And this might tell us a little bit more about their migration preferences. When we combine these, we can understand, alongside different other factors of the data, such as their age and sex, to understand the demographic profile of nurses applying. We can look at their experience profile, which basically records how long they were on the register before they decided to make their first application to potentially leave. And we can also think about how committed they are to leaving based on how many applications they've made, either to a single country or to many countries at any one period of time. So it's a really rich data set which previously wasn't able to be accessed prior to having an agreement with the NMC. And all of this data can then be supplemented with the published data from the NMC, which is on their annual register data. So the register, as I mentioned before, contains all the nurses that are registered with the NMC. It details how long they've been registered for, what their qualifications are, and as I said before, whether there are any black marks on their record. So in terms of how we decided to analyze the data set, of course, it was really important, first of all, to come up with some overall trend analysis. And this meant looking at application numbers over the period of time that we analyzed it for, but also looking at where they wanted to apply to and what those destination countries looked like. We then wanted to understand, well, what's the likelihood of applying for a specific country? And we wanted to do this based on the characteristics of the nurse. So we were able to calculate the number of CCPS applicants in a given group. So for example, those who are trained overseas or those who are trained in the UK, as a percentage of those on the register in that group at the end of that year. So this is a pretty weak proxy, but it gives us as good a reckoning as of any as to the likelihood of a specific nurse trying to make an application to leave the NMC. There were some other considerations. Of course, we know that there might have been some element of double counting. A single applicant can make multiple applications, but also the time period, as I'm sure you'll recall, covers pretty influential external events. So not only did the European Union departure vote happen in January 2020, but also the COVID-19 pandemic meant that movement was really restricted. So it'll be interesting to see how these external events actually go on to shape application preferences and patterns. So to save you all the suspense, I've shared the main findings at the beginning of my slides. So there were three main findings. Ultimately, the first one is that the number of UK registered nurses requesting a CCPS increased more than fourfold across the period. So this was a really substantial increase in the amount of interest to apply to work elsewhere. We also looked at kind of which nurses were more likely to make this type of application, and most of this increase came for nurses trained overseas. And interestingly, when we compared this against their experience profile, we also uncovered that most nurses who are trained overseas would be on the register for a shorter period of time before they started to make this application. And finally, where did these nurses want to go? Well, more than 4 in 5 CCPS applications were for just 3 countries: Australia, New Zealand, and the United States, all also suffering workforce shortages of their nursing staffing groups, and ultimately providing an idea of the level of competition there are for nurses internationally. So I'll talk you through some of the charts that we had prepared here. So across the period, we know that the number of CCPS applications went from just under 4,000 to over 12,000. And there's a really interesting distinction between what application patterns were like prior to COVID-19 and then after COVID-19. The majority of these applications, in fact, over 70% were from those trained overseas, so you can really see how they increased the number of applications towards the latter part of the period. And ultimately, these were a really substantial growth. So prior to COVID-19, the average growth in application numbers was about 10% per year. But in the last period, it more than doubled within the last year. So there's a massive amount of increase that happened in 22-23 relative to previous application patterns. In order to understand what scale might look like, so what distinction can we make between overseas trained applicants and UK trained applicants? Ultimately, we can see that OS trained applicants made up about 7% of those who were on the register. If we compare this to the number of applicants from the UK, this was just 1%. So if we were to compare those two statistics, we might say that overseas trained applicants were 7 times more likely to apply for a CCPS application than their UK trained counterparts. If we look at this chart, we're actually looking at how those joiners and applicants change over the period of time. And what we can look at between 2018-19 and 22-23 is that the number of overseas trained registrants joining the register, which is what we see as our inflow, more than doubled across the period. But also the number of overseas trained registrants applying for a CCPS, which is our potential outflow, grew substantially. In fact, it grew by 11 times across the period. So we're really trying to highlight just how stark this might be of an issue for our dependence on international recruitment. One of the other things that we were interested to look into was what we can actually start to learn about applicants. And so we started to compare, well, how long did overseas trained nurses stay on the register before they made their application? We compared the number of applicants to the number on the register each year, and we grouped this based on their experience profile. It's worth clarifying again here that you can be on the register, you only have to register once every 3 years, and perhaps you don't practice actually, you just do your 200 required hours and maybe you don't work as a nurse anymore. So there are some caveats to be aware of. The green bars, as you can see, are 2018-19, and the red bars are 22-23. And what you can see here is that there's a substantial increase in the likelihood of an overseas trained nurse making an application, regardless of their time on the register. But this becomes a lot more marked in the last year of the period of analysis, which actually showed us that 1 in 9 of overseas trained nurses who had just been on the register for less than a year were making their CCPS application. So before I also spoil the surprise about the implications, you can really understand what this means for sustainability. It means nurses perhaps are coming to join the NHS, to join the NMC, but then are quickly considering their alternative options. What were these options looking like? Where did these nurses want to go? Well, before we do that, it helps to look at where they were coming from. We know that the UK has a huge reliance on nurses trained in India and the Philippines. These are the 2 main source countries for overseas trained nurses who have joined the register over the period. What this slide shows you is basically just some headline stats. So the second bullet point really talks to about how many nurses we've been expecting every year from both India and the Philippines. So close to around 50,000 each, really supplementing our workforce. But when we look at what this period of application pattern has changed, in 2018-19, you would just have 1 in 120 Indian-trained nurses on the NMC register applying for a CCPS. But by the end of the period, this was just 1 in 10. So there's also a really big appetite for leaving soon after joining the NMC register. So this is obviously the 3 main countries that nurses were really keen to move to. Really striking, you'll see here, is that Australia and New Zealand have relatively stable levels of application. They match the trend line. And you'll also see a huge increase in the number of nurses applying for the US. Interestingly, this was a 10-fold increase from the year prior, so this really struck out to us as an outlier within the data. It really seemed obvious to us that maybe there were some policy changes that were contributing to why this change might have taken place. The other thing to recognize is that actually almost half of the OS-trained applications for the United States came from nurses trained in India, and just over 1/5 came from nurses trained in the Philippines. Why is all of this important? Well, in order for us to contextualize our findings, we started to look at what it means to migrate, what motivates an application for migration, and this boils down to 2 things that we can refer to as push and pull factors. Push factors, quite explanatory, they make you want to leave, and pull factors are what draw you in elsewhere. We know within the NHS there's a wealth of data on NHS staff surveys published, I think, every 2 years. And one of the findings that we were able to understand is that UK nurses tend to have lower job satisfaction. But we also know that 2022-23 was a busy year. There were national strikes across the country for pay. There was a cost of living crisis. We know that record levels of staffing shortages, having a strong reliance on bank or agency staff to fill shifts, and ultimately residual effects of being on the front line of the pandemic and suffering from huge levels of workload and stress. But most important of this, you'll probably be able to spot, is the lower annual earnings in the UK. And when you really compare how much UK nurses earn relative to their counterparts in different countries, the difference is really stark and will most likely be a strong motivating factor to leave. But what about the pull factors? Well, we also know that other countries across the global nursing labor market wanted to make it easier for nurses to come to them. So they've made it easier to recognize their qualifications, recognizing their level of study and their professional standing. They also might provide better pathways and progression for their careers, make it easier to become more established as a full-time nurse. The existence of migrant communities in these foreign countries might also be more inviting and appealing. But also in terms of immigration, how easy is it to join these other countries once you've been registered with the NMC or within the UK relative to just going there directly? So there's a lot of intricacies to understand how complex this picture is for migration, and pulling apart the analysis in this way was really important to contextualize the findings. So essentially, what are our policy implications as off the back of all this? Well, it's really important to know that ultimately UK nurses earn substantially less than their counterparts in Australia, New Zealand, and the US. New Zealand has a salary of about 50,000 USD when we adjust for purchasing power parity, compared to the UK's 41,000. Australia is somewhat higher with 74,900, and the US is miles ahead with 85,000 on average for a hospital nurse. So you can really see that comparison of earnings and what that might mean for nurses considering their next option. I've mentioned earlier the changing immigration policies. So we also know that actually there were accelerated processes of immigration. The New Zealand decided to implement an accelerated verification of professional standings, differences made to make it easier to come in and join the country. And also what we recognize within the US as well is that there was a rolling over of unused COVID-19 pandemic visas, which really supplemented and was the reason for that huge rise in applications for the US. So these were obviously held off because of the COVID-19 pandemic, movement was stalled. In order to free these up, the US government decided to roll them over to the next year, and so it created a huge opportunity to kind of apply and make the most of that opportunity. We know that within the NHS, there's a policy approach to really kind of ramp up active international recruitment, but this is the vulnerability that we're highlighting that comes about from recruiting from countries that have threats to their own sustainability of their healthcare system, those red list countries, but also the idea that ultimately perhaps there is this argument of the UK being a stepping stone on these nursing careers pathways. Ultimately, it's a good place to join, to get your experience, but then to consider your better options elsewhere. And it really points to the level of competition that exists for the UK internationally, whether we can compete as an NHS, as a recruiter for trained nurses, whilst not offering them as competitive a package as other competing economies might do. So what's the solution for all of this? There's really no easy solution, but we know that we need to do better for our nursing workforce, in fact, all of our workforces. We want to make sure that there's more effective retention of nurses, regardless of what country they have trained in, so including those UK registered nurses who were, and UK trained nurses considering their options elsewhere, but also those nurses who have trained overseas and ultimately are considering their options. We know that it might be difficult at the moment, however, when we think of this analysis, whether this is a one-off trend or whether this is something that will continue on. We have discussed with the Nursing and Midwifery Council what the next year's level of data might look like, and possible extensions of the research would also try to understand whether those nurses who applied for a CCPS then actually went on to leave. So that's kind of our question mark that's finishing there. And also to just touch on some of the black holes that exist within the data, if you look on the OECD website for international nursing counterparts, or which countries have a higher proportion of nurses that are trained in different countries, you'll see that data for the US finishes in 2016. And that means that we have a huge black hole in how we can conduct our policy analysis. So if it's not for analysis like this that shows the level of interest to join the States, or going through actual records from different registration authorities internationally, we will not know the scale of the problem and actually tend to sleepwalk into it. So it's really important that analysis like this and others that you'll no doubt hear today point out some of the things that are missing when it comes to understanding policy implications and really important decisions for stakeholders to make our nurses feel valued, to help retain them regardless of their country of training, and ultimately to help complement the workforce. I think I'm 2 minutes early, but happy to open for any questions.
Thank you very much. Just to remind everybody that there are some Slido questions and you can add to them or vote them up. What findings did you find when you were looking at the gender split? It was mentioned, but was there anything that you found?
Well, the majority of nurses on the NMC register, unsurprisingly, are female, actually. We didn't look into this as an area of research. It's also the same reason why we didn't further look into nurses applications that came from EU and EEA countries. As you can probably see, the numbers had remained really similar across the period and were very low. Those were things that we found were interesting, but obviously word count and publications meant that it was hard to look into. But this is a really extensive piece of area to look into. So definitely there's an idea to do that in future.
Thank you. There was a lot of work done examining racism experienced by junior doctors who completed medical school abroad. Is there any data available for nurses surrounding this or ensuring nurses can integrate well?
I think it's a really good question. I know in conversations with the NMC, they're really looking into how important it is to make sure all nurses registered with the NMC have a good experience. There is a difference in experience for those nurses who have trained abroad, or especially if they're working in areas that don't have very diverse communities and populations. This again would probably be an area of future research.
Were you able to explore differences for nurses in more senior posts or with specialisms requiring advanced training?
This is quite interesting. One of the things that we were able to find actually is that through earlier periods of the data, more senior nurses wouldn't really make a CCBS application. But actually towards the end of the period, there were nurses considering their options elsewhere in countries such as Australia and New Zealand. One of the things that we were also able to uncover related to kind of stepping stones and maybe getting to a country that maybe is more preferred is that New Zealand seems to be the gateway into Australia. So if you're able to find employment with New Zealand, it's relatively easier for you to join the Australian healthcare system, which seemed to be the preferred destination for some of these senior nurses as well.
How will you adapt your methodology if the research is continued?
That's a great question. I think I'd probably take a lot more time. You'll see that there were a lot of different ways to break apart the data and also to contextualize them with some of the existing data sources that exist externally. Potentially it would be to link up with the data from foreign registration authorities such as those in New Zealand, Australia and the US to see what their incoming profile would look like, to really understand whether this is a good measure of likelihood of application to leave or whether it's to avoid the word, but fear-mongering. So just to understand what the scale of the problem might look like.
And just finally to say thank you very much for what a wonderful presentation.
Thank you.
So we can break now for a break. We're a little bit early, so you might find that you have a little bit of a wait, but maybe you'll be the first for teas and coffees through in the section.